In this module, you will learn how to take blood pressure. The key terms for this module: blood pressure is the measurement of the force of the blood against the walls of the artery. Systolic pressure is the number at which the first sound is heard or the highest number when the blood pressure is measured. Diastolic pressure is the number at which the last sound is heard or the lowest number when the blood pressure is measured. There are two main types of blood pressure. There's hypertension, high blood pressure, which is greater than 140/90, and hypotension, low blood pressure, lower than 90/50. General guidelines when taking blood pressure. Equipment should be in good working condition. Use a cuff of correct size for the thickness of the upper arm. You may find that in older adults, especially women, you may have to use a cuff for young adults, especially children. Gauge the cuff correctly. Have the gauge at eye level. The resident should be sitting or lying in a relaxed, comfortable position with the arm resting on a solid surface. Use the arm indicated on the patient's care plan. If no arm is designated to be used, the left arm should be used. Do not use an arm that has an IV infusion in it or has been weakened by a stroke. Inflate the cuff to about 160 millimeters. If a sound is heard upon immediate release of air, deflate the cuff immediately to 0 and reinflate to a higher number. Record accurately as a fraction, such as 120/80. There are certain factors that do affect blood pressure that you need to be aware of. They are age, obesity, exercise and sleep, heart disease, diabetes, and heredity, pain, blood loss, and time of day also affects blood pressure. Like we said before, hypertension is blood pressure higher than 140/90, and hypotension, which is also deadly, is blood pressure lower than 90/60. Report promptly any abnormal vital signs. I hope you've enjoyed this lesson on blood pressure.